Picture this. You're at a family gathering and somebody confidently tells you that Medicare is totally free for everybody once you retire.
That can't be right.
Or maybe you've scrolled through social media and you've seen warnings that if you don't enroll the second you turn 65, you'll face penalties for the rest of your life. Sound familiar? Well, in that case, you're not alone. Medicare advice, it seems to be everywhere, yet much of it is misleading or plain wrong. And the worst part is that acting on incorrect advice can cost you thousands of dollars or leave you with glaring coverage gaps that you did not anticipate. My name is Cameron Giardini, and in this video, we are going to bust 5 of the most common and dangerous Medicare myths that might be influencing your healthcare decisions right now or in the near future. Whether you are just approaching Medicare eligibility, already enrolled, or if you think you're an expert, these myths might be causing you unnecessary anxiety about your coverage, or maybe they are simply impacting your loved ones who are also considering their Medicare options. In addition to today's video, if you do want more of your personal Medicare questions answered, please make sure to scan the QR code you can see here on the screen. This will take you to our private Facebook group where we can answer more of your personal Medicare questions. By the end of this video, you will know exactly which common knowledge statements are actually just myths, and you will discover how to protect yourself from costly Medicare pitfalls. Let's begin with perhaps one of the most expensive myths of all, and that is that Medicare is completely free. Many people, they believe that Medicare is free at age 65 because they have paid their Medicare taxes their entire career. Unfortunately, that is not the case. Part of the misconception that Medicare is free, it likely also comes from the fact that according to Medicare itself, about 99% of Medicare beneficiaries do not have to pay a Part A premium because themselves or their spouse have paid Medicare taxes long enough while working for 40 quarters, which is also 10 years. Now, on the off chance you do actually have to pay for Medicare Part A in 2025, just know this can be as high as $518 per month. However, if you are watching this video, it is more likely than not that you do qualify for premium-free Part A, which does cover hospital care and other services like skilled nursing, home health care, and hospice. But premium free, it does not mean cost free. And Medicare Part A is simply one part of Original Medicare. If you do have just Original Medicare coverage, which is both Part A and Part B of Medicare, if you are hospitalized as an inpatient in 2025, you are responsible for paying a Part A deductible of $1,676 per benefit period, which can occur more than just once during a calendar year. And if you do end up in the hospital for an extended period of time, you will pay daily copay charges, which you can see here on the screen. Lastly, if you are admitted to a skilled nursing facility with only Original Medicare coverage, although the first 20 days typically come with no copay, from days 21 to 100 in 2025, you would be responsible for $209.50 per day, and then the full cost from days 101 and beyond. Moving on from Part A, the real sticker shock for a lot of people, it comes from Medicare Part B, which covers outpatient services, doctor visits, and more. In 2025, the base Medicare Part B premium is $185 per month, and although that alone is substantially more than free, just know that Part B premiums in 2025, they can be as high as $628.90 per month due to the income-related monthly adjustment amount known as IRMA. The IRMA surcharge, it applies if your income is above the different thresholds that you can see here on the screen, and you can also see the chart that shows the IRMA surcharges also apply to Part D prescription drug coverage. Just know that typically your IRMA will be determined by your income from 2 years in the past. So for 2025, they are actually considering 2023 income initially. Thankfully, this can be appealed in many circumstances, but that is a topic for another video. Now, on top of the monthly Part B premiums, you must also meet an annual deductible of $257 per year in 2025 for Medicare Part B covered services. And that is also as long as they are not preventive. Then, if you only have original Medicare as your coverage, you typically pay 20% of the Medicare approved services after that. Original Medicare, it also has no out-of-pocket maximum, meaning there is simply no cap on what you might spend in a year if you have significant healthcare needs. So to summarize all of the original Medicare cost associated with Part A and Part B of Medicare, we will link to this document that you can see on the screen in the description below the video. We have already mentioned a few times the cost that you would be responsible for if you only have original Medicare, but the reality is that most of you watching this video, you will choose to enroll in either a Medicare Advantage or Medicare Supplement plan. And this brings us to another factor that contributes to the myth that Medicare is free, and that is the fact that Medicare Advantage plans, they are often advertised and even offered with $0 monthly premiums. Now, this is true. According to the Kaiser Family Foundation, as of 2024, 75% of Medicare Advantage enrollees, they pay $0 per month for their Medicare Advantage plan premiums. So although it is true that Medicare Advantage plans often have $0 monthly premiums, even if you are enrolled in that Medicare Advantage plan with no premium, you are still responsible for paying your Part B premium directly to the federal government. So while your friends at the gym, they might brag about how they quote unquote do not pay anything for their Medicare coverage.
We just pay them nothing? We pay them nothing!
Chances are they're only talking about their Medicare Advantage premium, and they simply aren't mentioning the Part B premiums that they are also paying. And they also aren't mentioning the fact that when they use their medical coverage, it comes with added costs in the form of copays and coinsurance, and in 2025, Medicare Advantage plans, they can have a maximum out-of-pocket limit, even for in-network services, as high as $9,350 just for the calendar year. Although it is good to mention that the median maximum out-of-pocket limit is actually closer to $5,400 in 2025. If you forego enrolling in a Medicare Advantage plan, and instead choose to pair your original Medicare coverage with a Medigap plan, plus Part D prescription drug coverage, as you might have already guessed, this coverage will also come with additional cost, which just further busts the myth that Medicare is free. Here on the screen, you can see the average premiums for most of the popular Medigap options across the country. Part D coverage, on the other hand, in 2025, it ranges from about $0 per month all the way to more than $100 per month. Thankfully, in exchange for paying the premiums for Medigap coverage, these plans, they will help you cover most of the out-of-pocket cost with original Medicare that we talked about earlier in the video, and this will depend on your plan's plan letter, as you can see by this chart on the screen. If you are sitting there feeling worried about a lot of the costs that we are talking about, just note there are programs that can help those with lower income. There is the Medicare Savings Program, also known as MSPs. They are designed to help people who meet certain income and resource limits, so we will link to more information about those programs in the description below. These are state-run programs, typically by the Medicaid program, and they help pay Medicare Part B premiums, deductibles, coinsurance, and more. The bottom line, though, is Medicare, it is not free. Even if you've paid into it your whole life, make sure you budget for more costs before you turn 65. Moving on from myth number 1, if you answer any phone call from an unknown number or you open the mail anytime after your 64th birthday, you will probably see countless ads making you feel like you are required to enroll in Medicare right when you turn 65. Yes, many people do need to enroll in Medicare when they are first eligible to avoid penalties and gaps in coverage, but there is also a large number of people that could save a lot of stress and money as they approach their infamous 65th birthday. I'll cut to the chase on this myth. Many people, they remain actively employed past age 65, or their spouse is still working and they're covered under a large employer's group health plan through theirs or their spouse's employment. If that employer has 20 or more employees, based on the Medicare guidelines that you can see here, you can typically delay Medicare Part B without facing a lifetime Part B penalty and your group coverage remains the primary payer, with Medicare being secondary if you even choose to enroll in it. This avoids crucial billing errors and gaps in coverage. A real-world example is Sarah. She turns 65 in June and works at a local company with 60 employees. Her husband is 63 and he is also covered by her employer plan. Sarah can stick with her employer coverage and delay Medicare Part B if she chooses. When she eventually does lose that coverage or just simply leaves that coverage, she'll have a special enrollment period to enroll in Medicare Part B without a late penalty. Had Sarah instead felt pressured to enroll in Medicare at age 65, simply because she believed it was mandatory, she likely would be paying for Medicare Part B with very little benefit for years until she chooses to retire. As we just talked about, that could cost her at least a minimum of $185 per month. And unfortunately, we see people enroll in Medicare even when they don't need to, at least several times per year, if not more. On the other hand, there are still many situations where you will want to enroll in both Part A and Part B of Medicare when you're first eligible at age 65. Some of these scenarios include if you have COBRA coverage, retiree coverage, or coverage through Health Share Ministries, or ACA Marketplace coverage. Or perhaps you are still actively working, but your employer has less than 20 employees, and therefore you need Medicare to be your primary coverage at age 65. Now, in these scenarios, you will of course still want to consult with an independent broker before you make your final decisions, but you will likely want to enroll in both Part A and Part B of Medicare during your initial enrollment period, which is the 7-month window that starts 3 months before the month you turn 65, includes the month you turn 65, and then extends for 3 months after that. We will provide a link in the description so that you can connect with us or another broker if you'd like. Or you can also go to our website, doineedmedicare.com, to learn more. You will also want to consider Medicare Advantage or Medigap coverage if you do need Medicare at age 65. So what should you do if you're nearing 65? First, find out and confirm with your employer the size of that employer that is providing your health insurance. 20 employees or more is the magic number for age 65 plus. Again, make sure the employer insurance is also based on active employment through yourself or a spouse. Second, compare the cost and benefits of your current coverage compared to Medicare. Third, if you do plan to delay your Medicare enrollment, get a letter from your current employer confirming that your coverage is also creditable for Medicare Part D to avoid any possible Part D prescription drug penalty in the future. Speaking of having coverage from a spouse, one of the biggest shocks for some couples is discovering that Medicare is individual-only coverage. It cannot be extended to a spouse or dependents like employer group health insurance can. When you enroll in Medicare, you are covering yourself and yourself alone. A classic example is Michael and Lisa. Michael's turning 65 and he plans to retire. He has been carrying employer health coverage for both him and Lisa, who is currently 62 years old. He wrongfully assumes that once he signs up for Medicare, Lisa is just automatically going to be covered through him and his Medicare coverage. But unfortunately, as you probably know, that is not how it works. The moment that Michael leaves his group coverage and transitions to Medicare, Lisa will need her own health insurance. She could get COBRA from Michael's former employer coverage, or she could find a marketplace plan or explore other options before she turns 65 and is eligible for Medicare herself. But this can be hard to do when it's not something you are planning. Now, the myth for this, it might stem from the fact that in some scenarios, it is possible to draw off of somebody else's Social Security benefits, such as a spouse. Or maybe by the fact that you can qualify for premium-free Part A based on your spouse's work history, even if you yourself have not earned all of the credits based on your personal work history. However, that does only apply once you yourself are age 65 or otherwise eligible for Medicare. At the same time, one of the beautiful things about Medicare coverage is the fact that it is individual coverage.
Why would you say that?
Now, what I mean by this is that oftentimes throughout life, you are reliant on a spouse or a family member for your health insurance, and you really don't have much of a choice to customize your coverage. That does change when you become eligible for Medicare. Maybe you and your spouse, you can't agree on choosing a Medicare Advantage or a Medigap plan, Or maybe you simply have different healthcare needs. Or maybe you want a high deductible G Medigap plan and your spouse wants a plan N instead. In these cases, you can each enroll in the coverage that you want and that you feel is right for you. You don't have to copy each other just because you think you have to. If you are in a situation where you'll be transitioning from employer coverage to Medicare, it is crucial to at least plan 6 months in advance if other family members are relying on you for their health insurance coverage. Half the battle is just planning and knowing what to budget for in that case. Since we have mentioned the choice of Medicare supplements and Medicare Advantage coverage throughout the video, we should also point out that there are some myths surrounding these coverage options. So much so that we hear people say, I have original Medicare with a supplement and a Medicare Advantage plan for extra benefits. Or they say, I have a PPO Medicare supplement plan. But that is simply not how these coverages work. You can't combine Medicare Advantage and Medigap coverage. They are two distinct coverage paths, and mixing them is not only unnecessary, but it's also against Medicare rules, and in fact, it's even illegal for us as brokers to sell somebody a Medigap plan while they also try to keep their Medicare Advantage coverage, and vice versa. Think of it like two different routes to the same destination, which is the hospital and the doctor's office. The first route is original Medicare, Part A and Part B, plus a Medicare supplement plan, as well as Part D prescription drug coverage. In that scenario, your original Medicare, it's your primary coverage, and your Medigap policy, it works as secondary coverage to help financially cover some of or all of the out-of-pocket costs left by original Medicare. Now the second route, it is a Medicare Advantage plan, which is sometimes called Part C, despite not being a part of Medicare. Essentially, in this case, Medicare pays a private insurance company to administer your Medicare benefits. The plan becomes your primary coverage instead of original Medicare. Now, it does often include Part D coverage as well as some extra benefits that original Medicare doesn't offer, like dental, vision, or even gym memberships, but what this coverage does not pair with is a Medigap plan. If you already have a Medigap plan, it won't work with a Medicare Advantage plan. A typical nightmare scenario is that someone, let's say Maria, enrolls in a Medicare Advantage plan, and then someone wrongfully convinces her that adding a Medicare supplement plan will help cover her copays. She signs up, paying premiums every month to the Medigap insurance company, yet she's not actually receiving any additional coverage because Medicare Advantage and Medigap, they simply do not combine. Or you could have somebody like Jane. She might be happy with her Medicare supplement, but she simply wants additional coverage for dental and vision. Instead of enrolling in a standalone dental and vision insurance plan, in addition to her Medigap, she unfortunately gets tricked into enrolling in a Medicare Advantage plan for the extra benefits. At the same time, she mistakenly thinks that she is going to maintain the coverage and flexibility of her Medigap plan, only to be shocked when she goes to the doctor and she learns her Medigap plan is no longer covering any of the cost since her Medicare is no longer her primary coverage. Here's the simplest way to remember it. A Medicare Advantage plan, it replaces original Medicare as your primary insurance. A Medicare supplement, by contrast, it fills in the financial gaps of original Medicare while original Medicare remains your primary coverage. They each have their pros and cons, but they operate completely differently and independently. You either pick one path or the other, but not both. Our final myth, it catches a lot of people off guard. Many people, they assume that their Medicare card will just appear in the mailbox around their 65th birthday, but that only happens in certain situations. If you're already receiving Social Security or Railroad Retirement Board benefits at least 4 months before you turn 65, then yes, you will be automatically enrolled in both Parts A and Part B. Your card in this case, it typically arrives about 3 months before your birth month as part of your Welcome to Medicare package. But if you have not started drawing Social Security benefits yet, you are responsible for enrolling yourself in Medicare if you want it. This means that if you are choosing to delay Social Security beyond age 65, like many people nowadays, you must actively sign up for Medicare during your initial enrollment period if you want your coverage to begin at age 65. Missing that window, it can be costly. Take Bob, for example. He was not collecting Social Security benefits and assumed he would be enrolled in Medicare at age 65 in June. And this was to replace his marketplace coverage through the Affordable Care Act. Due to rarely going to the doctor, Bob simply didn't pay much attention to his coverage, thinking it was all automatic, until he got pneumonia in November, and then he decided to go to the doctor. This is when he realized he had no Medicare coverage, and although he was eventually able to enroll in Part A retroactive to when he turned 65, he was unable to enroll in Part B in November, since his IEP ended in September, and in this case, he did not have a Part B special enrollment period. Instead, Bob unfortunately had to wait until January to apply for Part B of Medicare using the general enrollment period. This meant months of paying out of pocket for healthcare costs that simply should have been covered had he had Medicare like he wanted to when he turned 65. And he also even faced a Part D penalty in this case. To make sure you don't end up like Bob, make sure you watch our video about Medicare enrollment timelines after this one. Even those of you who are automatically enrolled sometimes need to take extra steps. For instance, if you're automatically enrolled in Part B but you don't want it because you still have active employer coverage, you will have to follow the instructions in your welcome packet and return your Medicare card to decline Part B before it becomes effective. If you don't do that, you'll start paying Medicare Part B premiums whether you want the coverage or not. The key takeaway here is simple. Don't assume you are automatically enrolled at age 65. Now, if you're not receiving Social Security benefits, but you do want Medicare Parts A and Part B, be proactive and go online to ssa.gov to enroll, or contact your local Social Security office. Sitting back and waiting, it might land you in a tough spot with penalties and gaps in coverage. Now we've debunked 5 major Medicare myths that have the potential to cost you a lot of money and leave you with big holes in your coverage. By now, you should have a much clearer picture of what Medicare does and does not do, and who needs to pay attention to the details. If you can dodge these 5 myths, which to me is a hard word to say, so sorry about that, but in that case, you're already well ahead of many people navigating the confusing world of Medicare. But you might still have questions. For instance, how do you pick the right Part D prescription plan? Or how do you decide between Medigap and Medicare Advantage coverage? Thankfully, you can answer these questions by watching both of these videos after this one.